From the studios of Foxboro Cable Access, located in the center of Foxborough, Massachusetts, you are watching Around Foxborough.
Hello and welcome to Around Foxborough. My name is Chris Allen. I'm here tonight with Maya Lespinas, why don't you tell us about your practice?
Okay. Yeah, so I'm Dr. Maya Lespinas. I am a pelvic floor physical therapist, and I'm also the owner of House Your Pelvis Physical Therapy and Wellness, which is in Foxborough, Massachusetts. So at my practice, I treat women of a broad range of ages. So my youngest client is 18, my oldest client is 72. Majority of my clients, it is for pregnancy and postpartum conditions such as urinary leakage, diastasis recti when the abs can overstretch during pregnancy, pelvic organ prolapse, painful intercourse, constipation, endometriosis, a whole host of women's health issues.
What's kind of the most important thing that you work with?
Well, they're all important, but the most common is urinary leakage.
Okay.
Probably across the board for women's health issues and pelvic health issues is urinary leakage. And it's probably the one that's the most talked about, like when you're out with your girlfriends and maybe you're laughing, you're having some drinks, you're like, oh my gosh, I just peed myself. So that is a really common complaint, but my goal is really to put it out there that even just a little bit is not considered normal.
Okay.
We really should not be experiencing any leakage at all.
Interesting.
Yeah.
What caused you to get into this field?
Yeah. So in middle school, I was a big soccer player. I hurt my hip, a very simple hip injury. And I had to have physical therapy on my hip.
Okay.
And that made me really interested. I was really into anatomy. But also at that young age, I was really into babies. So I was watching Teen Mom on MTV and A Baby Story, I think on TLC. But I also knew at that age that I did not want to be an OBGYN. So it kind of stayed in the back of my mind. And once I got to PT school, on one of the rotations, there was a PT that was always going into a private room with pregnant women. I asked to shadow her. And I was like, okay, this is the bridge between those two interests that I had.
That's pretty cool.
Yeah.
So how long have you been in practice?
I've been a PT for about 8 years now. Yeah, a little
Awesome.
over 8 years. Yeah.
Where's your office?
So my office is in Foxborough. It's on right on 106, right in front of All About You Salon.
Okay.
Yeah.
Is there anything you feel like people should know about physical therapy or pelvic floor specifically or?
Yeah, that's a great question. So I think a lot of people think there used to be this connotation that pelvic floor PT is just Kegels. And that's not the case. It is so much more than that. It is so much more in depth. There's internal exams, there's rectal exams, there's fascial techniques that I do, there's different dry needling techniques that I do. So Kegeling is like one very small piece of pelvic health. And it's actually something that I don't prescribe that often. So that is probably like one of the biggest misconceptions from doctors and from patients, that they think that pelvic floor PT is just like this simple little thing that we do or something on the side of physical therapy.
Yeah, because that's when I think pelvic health, that's what I think of immediately.
Right.
I didn't know there was a whole
specialty with it.
Complete specialty involved.
Yeah.
If people are interested in learning more about it or more about your practice, where can they go?
Yes, so my website is www.houseyourpelvis.com.
Okay.
Same thing with Google. My Instagram is houseyourpelvis. And yeah, generally if you Google my name, you'll see everything pop up as well.
Awesome. Other than the urinary incontinence, is there anything else that people may feel is normal that isn't necessarily okay? Or
I would say the pain with intercourse, especially around menopause and postpartum, and in general, that, if it's uncomfortable, that's considered normal, but it really isn't at any point in your life. And of course, it's typically multifactorial, right? There could be a hormonal component, an arousal component, but a lot of times there also is a pelvic floor muscle component.
Interesting.
And that's something that people are a little bit surprised that is a diagnosis that I treat in pelvic health. Yeah.
Wow.
Conditions like endometriosis or any type of abdominal surgery, so like a C-section, a myomectomy, which is a fibroid removal surgery, any type of abdominal surgery, I do recommend that you should go to pelvic floor PT. It can help aid in your recovery. You know, when people get a knee replacement, it's automatic that you go to PT, right? But after a C-section, it's not. So one of my big goals is trying to, one, educate about pelvic health, and two, change what's considered normal. There are some hospitals across the country that are making pelvic floor PT more standard after having a baby, but we're not at where we need to be yet. So I'm trying to be a small piece of that goal.
Are there any movements or is there any way people can get involved in drawing attention to it? Or
there definitely are. I can't think of one right off the top of my head, but there are definitely organizations, different conventions that occur, even just contacting local hospitals and asking questions, asking your OBs. I do feel like OBs, it should be pretty much an automatic referral. And I think that has improved over the years, even compared to 8 years ago to where we are now. It is much more talked about.
Right.
I think some people think too that pelvic health is taboo, and it really shouldn't be. It's just another thing that we should be addressing. The same way if you have shoulder pain, you would go to PT.
Do people need any referrals or anything to come to your practice? Or?
No, actually. So Massachusetts is a direct access state, so no referral is needed.
Awesome.
For my practice.
Is there anything else you think people should know?
Yeah, I mean, generally, my goal is really to make these conversations more normal, and to know that if you are experiencing these issues, they're often very silent, right? Like, these aren't things that they're necessarily talking to their best friend about or even their partner about. A lot of times I and maybe their doctor are the first time they're saying certain things out loud. So if you are somebody that's experiencing any of these issues, just know that you are not alone. Your one of your friends is probably dealing with it too. It's just that nobody's talking about it.
Yeah, a lot of times uncomfortable for people.
Right. And it's silent. You can't see it.
Yeah.
Right? Like if somebody's limping up the steps, you're like, oh, I wonder if her knee hurts, right? But if somebody's having a pelvic floor muscle spasm, you can't see it. So, and people aren't just going to say like, oh, my pelvic floor is spasming, right? So yeah, that is one of my big goals, is to just normalize all of this.
Thank you for taking the time to come down here.
Yeah, thank you for having me.
Absolutely.
And thank you to Jury Love for having me as well, yes.
Thank you to Jury Love. Thank you for tuning in to Around Foxborough. My name is Chris Allen. We can be found at fcatv.org. The executive producer is Michael Weber. The director is Paul Beck. The producer is Jury Love. And thank you. Have a good night.
Have a good night.